Monkeypox, a viral disease endemic to Africa, is fast spreading to non-endemic countries, including UK, US, Canada, and other countries. But what is this monkeypox? How does it spread? Are you at risk? Is it as contagious as coronavirus? What do you need to do to protect yourself? Watch this video to the very end. All these questions will be fully addressed in this very video. Now, let us first look at what is this monkeypox. Well, monkeypox is a rare disease caused by virus. It was 1958 that during the research, the two monkeys that were used for the research developed these symptoms. And then that was how they named it monkeypox. But the first case of monkeypox in human was 1970 in Democratic Republic of Congo. That was when they saw this monkeypox in humans. This monkeypox is a zoonotic disease. That means it is spread from animals to humans. It passes from animals to animal, then from animals to humans, and from humans to humans. That is why they call it a zoonotic disease. Well, what are the symptoms of this smallpox? The symptoms of this smallpox are related, similar to the ones of the symptoms of the monkeypox, is related to that of smallpox. Yes, but the symptom of monkeypox is milder. It's not as serious as that of smallpox. After one contracts the monkeypox, usually within 5 to 21 days, the first symptoms will appear. The first symptoms of the monkeypox, usually fever, is commonly the first symptom. After that, the person begins to experience pains, headache, back pains, waist pains, then fatigue, chills, and then swollen lymph nodes. These are the symptoms. Then after the fever develops, we have other symptoms that appear like a rash. After 1 to 3 days, we see the person develop rashes. And these rashes will now develop into bumps that appears in the face, in the palms, in the soles of the feet, at the genitals, at the eyes, at the mouth. Then the person will have these bumps. This rash that is that develop into big bumps. That's how it is. But it does not develop into bumps immediately. There are about 4 stages it will go before it can now develop fully into bumps. That is the way the symptoms progress. Now, how can one contract this disease? What is the mode of transmission of this monkeypox? Well, this monkeypox is normally spread through contact. The virus there get into humans through contact with infected animals or infected persons. So once the person comes into contact with infected animal or infected clothing, beddings, and other things like that, then that's how somebody can get the disease. Some people even get it by handling the wild game. Those who are hunters, who are into hunting, or have any interaction with animals, individuals like that can have infection, can be infected by this disease. And most times it is through the body fluids, through the sores, of an infected person or infected animals. That is the way it normally spread. So, but among humans, they can be contracted through respiratory infection, through respiratory secretions. Yes, when somebody comes into contact with another person, through kissing, through hugging, through cuddling with an infected person, the healthy person can get the disease. So at this time, individuals can be very careful how they move with their loved ones, especially your friend, the person whom you love, how you move with that person, because the person can be a carrier and you don't know. So that's why you should be very, very careful this time. But as scientists are telling us that at this time, it's not yet confirmed whether monkeypox virus can be spread through semen or vaginal fluids. It's not yet established whether it can be transmitted by this way. Then, what are the prevention? How can you prevent it? That is important. Very simple. Avoid contact with animals that could harbor the disease. Avoid contact with infected materials like beddings, bed linings, and things like that. Avoid contact with those persons. Then those health professionals, isolate sick people. Those who are infected, isolate them from healthy ones so that they will not transmit the disease to healthy persons. It's very, very important. And you, if you're in healthcare, use personal protective equipment when caring for patients who has this disease. Then what are the treatments? How can you handle a case of monkeypox? Well, if you are a patient, if you suspect that you have contracted monkeypox, seek medical help. Go to your doctor who will now handle your case. It's not safe to to embark on self-medication. As we say that most cases of monkeypox are self-limiting. The disease can go out on its own without treatment. But there has been cases of complication arising from this monkeypox. That is why seeking medical advice from a qualified medical practitioner will be ideal in this situation. So, although there are no treatment specifically made for this monkeypox at this time, but medical authorities strongly believe that treatment for smallpox and vaccine for smallpox can limit the extent the disease can go. So any treatment that a doctor can use to handle smallpox, for those whose case is serious, it can equally be used to handle this monkeypox. Can you, if you are getting value to this video, from this video, subscribe to this channel. We have many videos and we're making videos regularly on health issues. We give you correct information, adequate, right information you need so you can make wise decision in handling a case like this, including diabetes, including high blood pressure, including stress, including healthy living, how you can be healthier, strong, and be willing to and be capable of enjoying life. You are enjoying life because you are healthy. If you are sick, incapacitated by ill health, that will limit what you can do in life. There are things you are going to do to be healthy. We have regular videos on all this way. Subscribe to this channel for more, and we are going to be providing updates on this monkeypox in our future videos. So when you subscribe, you can be acquainted with all these things, because you'll be notified whenever we drop the next video. See you in the next video.